Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. The most important thing for a natural pregnancy is ovulation of egg. What does it mean? In the ovaries, there are multiple eggs, but during ovulation, one egg which reaches the right size ovulates. It just does not ovulate on its own. There are some very important hormones playing here. There are follicle stimulating hormone, luteinizing hormone, estrogen, progesterone. All these are acting at different time intervals, some together, to increase the size of the egg, to select the best egg with the maximum capacity to fertilize, and also for this egg to ovulate from the ovary and get into the tubes waiting for the sperms. So for an egg to ovulate from the ovaries, a very important hormone called luteinizing hormone is important. Follicle stimulating hormone keeps on increasing, and when it spikes, the size of the egg also increases. As this happens, the luteinizing hormone also increases. That's because estrogen also plays a very important role here, and this luteinizing hormone, once it reaches its spike, it's called luteinizing hormone LH surge. About 12 to 36 hours after LH surge, the egg ovulates. And having sperms inside the uterus and the tubes is good for maximizing your chance of pregnancy. So by conducting an LH surge investigation or a test by using an LH kit, you understand whether there has been a spike in the LH and you have ovulated or are going to ovulate, because from LH surge comes the information that you're going to ovulate, which is very good, and that's when you can begin to have intercourse to maximize your chance of pregnancy. Unlike BBT, basal body temperature, LH surge gives us the estimate that the egg is about to ovulate, not ovulated but about to ovulate. It's very easy for patients to then have intercourse and increase their chances of success. So while BBT, basal body temperature test, tells us that when are you ovulating, this is a good estimate for the next month. But an LH kit gives us the estimate that you are going to ovulate. Therefore, it's good to have intercourse to increase your chance of success. To understand more about this, to plan your pregnancy naturally, or if you have planned it according to the protocols which are already available but are not getting pregnant and want to know your options with your condition, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.